Keratoconus is basically a disease where the front surface of the eye or the cornea, which is normally spherical or round, starts to bend irregularly and starts to bulge and becomes like a cone. So, this is called keratoconus or the cornea or the clear front window of the eye bulging forwards. In the olden days, say about 30 years ago, the only option we had for these patients was counseling, and then we would give them a pair of hard contact lenses to wear called semi-soft contact lenses. Some people could adjust to the lens and some people just couldn't adjust to the lens because it was a hard piece of plastic. The patient wore the lens and the keratoconus kept progressing. After a point, they couldn't wear the contact lens anymore, and then we had to replace the cornea in a procedure called penetrating keratoplasty, which means a corneal transplant. When somebody donates their eyes today after their demise, or the relatives donate the patient's eyes, we harvest the cornea, we take that cornea, and then we transplant it onto patients like keratoconus patients or patients who have lost their vision because of corneal blindness or because of the clear front window of the eye becoming opaque. So, keratoconus in a nutshell is a disease where the cornea bends forwards irregularly. Now, there are modern options to treat this disease called cross-linking. So, we do a procedure called Avidro customized cross-linking, and we have one of the only machines in the country for this. We use a specific solution which has vitamin B called riboflavin in the solution. We pour this solution on the cornea. The solution will seep into the cornea, and then we shine a certain wavelength of light for a predetermined number of seconds. So, for example, for very bad keratoconus, we would soak the cornea for 3 minutes and then shine the light for 3 minutes. And in a milder case, we would soak it for 1 minute and shine the light for 1 minute. This is called corneal cross-linking. It's not new and was developed nearly 30 years ago in the late 90s in Switzerland by a gentleman named Theo Seiler. And what Theo found was that if you cross-link the cornea, it would make it stiff and prevent the progression of keratoconus. I have a lot of patients with keratoconus, and keratoconus is becoming a public health problem because of the amount of allergies in the population and because of the amount of rubbing of the eyes. The preponderance of keratoconus in the population is increasing. But today we have a solution for this. If we catch the patient early enough, we can easily do a corneal cross-linking and halt the procedure getting worse and worse. Of course, if a patient comes to us with very advanced keratoconus and really bad vision and a very thinned out cornea with a big cone, we cannot do a cross-linking. In this case, we resort to a surgery called DALK or deep anterior lamellar keratoplasty, where the front layers of the cornea are replaced with a donor cornea. This makes the cornea thick again and the patient can see again. And we have done hundreds of these cases, and it restores the sight of the person that was actually quite bad before.